Hi, it's Paul Sackis, Good News Planet. I'm speaking with Eric Hall. Hi, Eric. How are you?
And good morning. Thanks for having us.
Okay. Well, you're talking about important work here. President and founding Chief Executive Officer for the Alzheimer's Foundation of America, and Dr. Barry Rogner. Hi, Doctor. How are you?
I'm good, thank you.
Excellent. You're Director of Division of Geriatric Psychiatry at Thomas Jefferson University, as well as Professor of Neurology and Psychiatry and Human Behavior Departments. Okay. Doctor, let me ask you, but we're talking about Alzheimer's. Do all these things play out in Alzheimer's disease?
Absolutely. Alzheimer's disease is increasingly becoming an important public health problem as more older persons develop the condition. And right now, about 5.5 million people in America have Alzheimer's disease. It's a progressive condition, which means it gets worse over time. For caregivers, the implications there are for them to observe carefully what symptoms they're seeing in their relative, to write those symptoms down, to talk with their doctor about them, to empower their doctor to be able to help them with medications and advising them on daily routines.
Alzheimer's evolves from the brain?
Alzheimer's is a disease of the brain.
Okay. That we, at this point, don't have really the cure, but we have some solutions that make the situation a little bit kinder to a soul?
It is, and the best way to make it kinder to a soul is to have empowered caregivers who are knowledgeable about how to deal with the day-to-day changes that they're observing. And that's where the Alzheimer's Foundation can be very helpful.
Okay, Eric, tell us about your organization, and thank you for creating it.
It's fine. You know, I have a personal experience, and so I know firsthand just how important resources are. And so the Alzheimer's Foundation of America's website is a great resource. It allows the opportunity for individuals to come to the website and find information about what is Alzheimer's disease, what treatments are available, some of the behavioral manifestations of the disease, and especially to what constitutes caregiving. How do we provide care? The recent survey, and the reason all this is really important is that the recent survey sort of talks about how this disease impacts a family. And so caregivers talked about how their own health has been impacted by their role as being a caregiver. And additionally, how 60% talked about how being a caregiver was overwhelming. We at the Alzheimer's Foundation of America firmly believe that if we surround you as a caregiver with all the resources and support, and we connect you to local resources, and we give you all the educational materials you need, we can actually ease the burden on you as a caregiver, and that's really quite critical and important.
So tell us, how did this survey, how was it created?
The survey itself was really just taking a look and asking the big questions. What is this disease? How does it sort of impact caregivers? What is the caregiver's role? And so, you know, the piece that came up about how caregivers were aware and sort of recognized that there was cognitive issues, that there were symptoms, that there was some change of in their loved one about their memories, and that there was also some level of confusion there. It really just talked about how important it was to observe those things and to talk to your doctor. It really sort of gave a clear intro into just how important it is to talk to your doctor about these issues, to be proactive about concerns that you have, and additionally, you know, look for diagnosis and treatment.
How did you did mention that it personally has affected you. How did you notice there was some kind of a change, I guess, in your parents, or in
it was something that sort of came about, and you know, for us was very clear that, you know, our loved one was not the same way they used to be, and so it wasn't so much progressive for us, but something that we really came to light on. And so we talked to doctors, we got the proper care, and that's really where the Alzheimer's Foundation of America comes out of it. It's about trying to surround us with care until there's a cure, and regrettably that's the problem here, is that there is no cure presently for Alzheimer's disease, but there are treatments available, and it is really important that we are proactive in looking for issues and talking with our doctor, getting properly diagnosed and treated, and then also especially being surrounded by an organization like the Alzheimer's Foundation of America that can walk the journey with you as a caregiver.
Doctor, some people, I imagine, just say, it's just old age, right? Or, you know, they kind of shrug it off a little bit, the situation. Is that so? Or how do you recognize if it's not something that you should be shrugging off? And what are some solutions? What's some good news here?
Well, the truth is, as you say, A lot of people make mistakes thinking, well, it's just normal aging, it's just, quotes, normal senility. But that's a mistake because it's not normal. Losing your memory is not a normal part of aging. But when it happens, it represents a diagnosis, a condition that needs treatment. So you need to take it seriously and go to a doctor, get the proper diagnosis, and then be instructed about the kinds of treatments that are available and lifestyle changes that can be made to make it easier for the patient and help the caregiver function more highly.
Why does it normally occur with older people, and as our generations are getting older and older, will that mean that there's more concern?
It happens because Alzheimer's is an age-dependent condition. The fact is that the risk of the condition increases with age, such that about half the people over 90 will have Alzheimer's, and a third of the people at age 85 will have Alzheimer's. And that's just a lot of people.
So isn't it just could you deduce that it's a breaking down of something in the brain?
It is. It's misprocessing of proteins in the brain that happen with aging. It doesn't happen to everybody, but it happens to a lot of people. And proteins that are normally managed in such a way as to prevent cognitive decline get misaligned, and they accumulate, and they lead to brain damage. So it clearly is not part of normal aging. It represents a distinct disease.
You had some companies behind this, so didn't you, Eric, who helped to get this important information out there?
Sure, absolutely. Eisai and Pfizer have been really very supportive. Education and models of education like this are really important. I know there's people watching right now who have issues in their families. I know there are questions, and so I would really ask, if you'd like, please reach out to the Alzheimer's Foundation of America at alzfdn.org, or take the time now, call our hotline, talk to a licensed social worker at 866-232-8484.
Quick one, Eric. What's good news for you?
Good news for me is actually meeting individuals like Dr. Rovner and others who are researching this disease. My hope really lies in them and their passion and their commitment to actually one day find a cure and eradicate Alzheimer's disease.
Dr. Rovner?
I'm hopeful about that happening. I think that in time, and not too far in the future, we'll be able to find ways to prevent or slow the course of Alzheimer's disease. I'm really excited about those possibilities.
Good men. Okay, thank you very much for sharing the good news with us.
Thanks for having us.
Take care. Bye-bye.